It's kinda dark out. I do think this fight of the light, fight of the light. This is a rough draft, but fuck it, the timing was right.
Hello. We're thrilled to introduce Neuralink's PRIME study, the first clinical trial of a groundbreaking experimental device that could help transform the lives of people with paralysis. Imagine the joy of connecting with your loved ones, browsing the web, or even playing games using only your thoughts. This is made possible by placing a small, cosmetically invisible implant in a part of your brain that plans movements. The device is designed to interpret your neural activity so you can operate a computer or a smartphone by simply thinking about moving. No wires or physical movement are required. By participating in the PRIME study, you'd be helping to redefine the boundaries of human capability. If you've been living with quadriplegia from a spinal cord injury or with ALS, you may qualify for the PRIME study. We'd love to share more with you and get you on board. Visit our website today to learn.
Brain implant technology will aim to restore vision and cure blindness.
The first two applications we're going to aim for in humans are restoring vision.
Controversial Neuralink is ready to test its brain chip implant on humans.
Elon Musk's brain implant startup Neuralink is recruiting patients for a clinical trial.
Just based on the potential of the technology it's developing. Now, the concept of brain-computer interfaces is not new. In fact, researchers have been working on this technology for decades. I can actually remember one of the most impactful lectures I listened to when I was a freshman in college. I was in an introductory neuroscience class, one of those big lecture halls, and there was a guest speaker talking to us that day. His name was John Donahue. I didn't know it at the time, but Dr. Donahue was actually one of the pioneers, one of the godfathers of computer-brain interfaces. During his talk, Dr. Donahue showed us videos of the technology he had been working on for years. He and his team were implanting electrodes or computer chips into people's brains and plugging them into computers. And I distinctly remember this grainy footage he showed us. He had patients who were paralyzed, either from trauma or other spinal cord injuries, and with this technology, they were able to control computers, not with a mouse or a keyboard, but entirely with their minds. And they even had patients moving prosthetic limbs, all with their thoughts. Approval to begin human clinical trials, and in 2024, Neuralink will be implanting their microcomputers into human brains on real, live people. And they'll be using automated surgical robots to perform the surgery. Neuralink detects light signals. Our retinas take these light signals, then convert them into electrical signals, which can get sent along the optic nerve to the visual cortex in the back part of our brains. So if any component along this pathway is malfunctioning, perhaps a cataract or clouding of the lens in your eyes is preventing light from hitting your retina, or maybe glaucoma is causing damage to the optic nerve. If any portion of the visual pathway isn't working, then we will have problems in our vision. And one of the fundamental concepts of how our visual system is designed is what's called the retinotopic map. What this means is that our brains organize information about where things are in the visual world around us. So each neuron in the visual cortex, or the part of the brain that's responsible for our sight, each neuron will fire based on a small part of the visual field, which is called its visual receptive field. And the way the map is set up, it's inverted. So, for example, if you see something here on the right side of your visual field, then a neuron will fire here on the left side of your brain. And then if you see something on the left side of your visual world, then a neuron here on the right side of your brain will fire. To really illustrate this point, look at this figure from a paper published in 2017. We're looking at the visual cortex of a mouse brain, and we're seeing the mouse's brain activity light up as the mouse watches a dot moving around. The way the mouse's brain is set up is like our brains too. It's inverted. So when the dot moves up, the bottom part of the brain fires. And then when the dot moves down, the top part of the brain fires. With this information, scientists can basically map out each point in our visual world with a specific location in our brains. The reason why this knowledge is so powerful is because, in theory, if you can stimulate specific neurons in our visual cortex in just the right pattern, you can recreate the experience of seeing the world around us. For example, if you stimulate neurons in the brain in the pattern of a triangle in just the right location, you can have a patient see a triangle. Or maybe if you wanted them to see a smiley face, you can do that too. And that's basically the premise of these computer vision, computer brain interfaces. With our natural eye-brain interface, our retinas and our optic nerves send vision data from the world around us to our visual cortex for processing. But with Neuralink's technology, they're basically replacing the eye and the optic nerve component with a camera and a computer instead. This is, of course, a lot easier said than done. And in order for them to